Hey everybody, Dan here with Pain Free You. Today's topic is going to be, do I need therapy to recover from TMS? So, it's about 65, 68 degrees out. It's gorgeous, it's sunny. Take a few breaths with me. Breathe in something positive. Exhale something negative. All right. So, do you need therapy to get better from TMS, to recover from this mind-body syndrome, this perceived danger pain? My immediate answer is, it depends. But most likely not. All right. Yes, Sarno was right. The emotions were perceived as dangerous. And yes, for many, but not all, many of us, the emotions or the stress or the chaotic time of our life may have been when the pain started, and his theory that the brain was trying to distract you, or in my words, protect you from those emotions with something physical like pain, that very well could have been the case. But in many cases, the scenario that was going on at the time your pain started may have long ago been resolved. It no longer bothers you. It's not an issue any longer. So I'm not quite convinced going back in time to relive those chaotic times or figure out what the offending emotion was is required in order to get better. And as you know, if you've followed my videos for any length of time, I spend an awful lot of time talking about creating safety in the now. When I talk about feeling emotions, I'm talking about deal with your right now emotions. We don't have past emotions. We just don't. We have emotions about our past, but we don't have past emotions. We can't time travel. We can't feel exactly what we were feeling back then. All we can do is kind of remember the situation, and the memory can stir up some of the same type of emotions. But so far, and I've been doing this a long time, I don't see a lot of people finding that golden ticket from a lifelong, past emotion that's the key to open the door to this TMS recovery. And virtually every week, I talk to more and more people who say, yeah, I've been doing all this. I've been doing the emotional discovery, the journaling. I've done therapy. It was nice to talk to somebody about my emotional response to life, but it didn't get me anywhere with my pain or symptoms. And so, do you need therapy? If you feel like you do, then consider it. But I'm not sure it's required to get better from TMS. So, therapy can be very good for a whole lot of reasons, but I'm not sure it needs to be connected to the recover from TMS process. I think whether you've got anxiety, depression, chronic pain, chronic illness, they all kind of stem from the same thing, which is this perception that I'm in danger, this perception that I'm broken. And if you feel broken, generally, your brain's going to perceive danger. And that goes for mental health as well. If you feel that you've got a depression disorder and a brain chemical imbalance that, maybe you are told has run in your family, that creates a perception of danger. So anytime you feel sad, you're going to be overly fearful of that sadness because, oh my God, the depression's back. And again, I'm not minimizing the severity of some of the emotions and depression and anxiety people feel, whether it be in this community or not. I'm not minimizing it all. But I do believe our perception of ourselves as a broken individual, emotionally, mentally, physically, makes a big, big impact in how much we struggle with the emotional, mental, or physical symptoms, right? Do you need therapy to get better? I've talked to a lot of people who've had therapy and that wasn't the ticket. So, what do I think it takes to get better? Again, I've been talking about this a lot the past couple weeks. Accurate knowledge to dial down the fear, and then calm, soothing safety. Teach the brain that I'm not in danger so the whole system can kind of settle down. If therapy helps you do that and helps you come to a place of peace with your emotional history and your current emotional state, wonderful. But I don't know that it's necessary as part of the TMS recovery. And look, I know Dr. Sarno used to say 10% of people are going to need therapy. There's a lot of people who've gone to a lot of therapy. A lot of people going to TMS therapists. Just be careful who you're working with. If the person you're going to has not had their own bout of chronic pain or chronic illness caused by TMS or mind-body syndrome, how well are they going to be able to help you? So that might be a really good interview question before you sign up for a whole bunch of expensive therapy. Does this person understand TMS? And are they going to be able to guide you through it? Or are they going to encourage you to talk about your childhood? In the hope that you stumble on this mystery emotion that unlocks the door. So I'm not dismissing, hopefully nobody is taking offense, anybody in the psychological profession, in the psychotherapy profession. I'm not trying to insult anybody. But I do believe that this TMS has more of an issue to do with perceived danger and the lack of safety, mentally, physically, and emotionally. And if we can teach ourselves that we're safe, mentally, physically, and emotionally, we got a really good chance to have the brain feel safe and turn down the pain. And I'm seeing it work reliably well with my individual coaching clients, with my group coaching clients, and with people just watching my videos around the globe. I'm going to keep on sharing success stories as often as I get them, but I don't solicit them. I'm not going out looking for them. If people mention something cool, I'll share it. If somebody says, hey, I'd like to do a video interview with you, great, here's my schedule, here's how you get on it. But people are getting better. Understanding knowledge therapy, safety therapy, and one of my coaching clients mentioned nature therapy. Get outside. It's good for the soul, it's good for the heart, and it's good for our emotions. So, do you need therapy? That's a personal decision. If you're going and you find that it's stirring things up and making you feel less safe, evaluate whether or not that's moving you in the right direction or causing you to look in the rearview mirror while you're trying to move forward. I don't know. Not a huge fan of it, but some people say working with a good therapist was a key for them, in which case, wonderful. Only you can make that decision. But if the thought of therapy doesn't sit well with you, at least breathe a sigh of relief, because I don't think it's required, because I'm seeing a lot of people getting better without it. I think it's much more important to teach yourself that you're safe now today, emotionally, physically, mentally, than it is to go rehash something that may have happened, years, decades ago, and try to figure that out and what it means about you today. We all have these brains and nervous systems that are the way they are because of our life history. But you don't have to go to the past to fix it. How about teaching yourself that you're okay now? That's really what I focus on. That's my approach. It may be different from some of the other TMS folks out there, whether they be doctors, therapists, coaches. I try not to focus on what's wrong with us. I try to focus on what's right with us, which is that if you look around, you're probably a lot safer than you feel on a day-to-day basis. And I don't believe that looking at everything that's wrong with us, particularly our pain or symptoms, and viewing ourselves as broken and labeling ourselves as broken and using medical labels to define who we are, I don't know that that teaches our hypersensitive, always on the lookout for danger brains that we're safe. So I like focusing on accurate knowledge to dial down the fear, and then safety therapy, or consistent messages of safety to feel better. And yes, getting out in nature, that helps us feel better. Because nature is just awesome. There's something about being outside in the sunshine that beats the heck out of being indoors in artificial light. So that's what I got for you today. Love you guys and gals, and we'll see you tomorrow. Love you.